Are Gen Z's mental health days actually costing them their jobs? This is a question many businesses are grappling with, as they see a surge in young employees taking time off for stress and burnout. While prioritizing mental well-being is crucial, a new study suggests that these absences are having a significant impact on workplaces and potentially creating a negative perception of younger workers. Let's dive into the details and explore the complexities of this issue. A recent study from Macquarie University reveals a staggering 26 million workdays are lost each year due to psychological distress among young Australian workers, aged 18 to 29. That's a huge number. This makes them the most stressed demographic in the country, alongside women and those residing in Victoria. To put it in perspective, these young workers are 1.5 times more likely to experience distress compared to their colleagues aged 50 to 64, according to the report, titled Workforce Psychological Distress and Absenteeism in Australia. The research is based on data from the Australian Bureau of Statistics National Health Survey from 2020 and 2021. Christy Burns, the lead author and a lecturer at Macquarie University, points out that young workers often find themselves in precarious employment situations. Apart from job insecurity, young people are also more often exposed to workplace conflict, low control over their work, and bullying, which are all associated with poorer mental health, she explained. These factors contribute significantly to their stress levels and subsequent absenteeism. They often hold casual roles with limited job security, leading to considerable financial strain. But here's where it gets controversial. Are employers starting to view Gen Z as a risky hire because of this trend? Ms. Burns expresses concern that employers might shy away from hiring young workers based on these statistics. She emphasizes the valuable contributions young people make to the workplace. Young people make important contributions to the workplace, and we know that being employed improves mental health. And it's important for society that young people are viewed as an important and valuable part of the workforce. Employment, after all, can be a vital component of overall well-being, and excluding young people could create a damaging cycle. This trend reflects a broader increase in psychological distress across the population over the past 2 decades, a trend likely amplified by the COVID-19 pandemic, Ms. Burns told the Advertiser. The report estimates that stress costs Australian workplaces nearly $17 billion annually. Highly stressed workers miss, on average, more than 20 days of work per year, a whole month more than their less stressed counterparts. Psychological distress is also a factor in about 10% of serious injury claims, and 18% of workers report experiencing it. Clerical and administrative workers report the highest levels of distress, 25.9%, followed by those in financial and insurance services, 23%. On the other end of the spectrum, the mining industry reports the lowest stress levels, 8.5%. And this is the part most people miss. While the overall number of days taken off due to distress is estimated at 56 million, younger workers account for the largest share, 26 million days, despite representing a smaller portion of the workforce. Healthcare, education and training, accommodation and food services, and retail are the sectors with the highest rates of absenteeism due to stress. The report also highlights gender disparities, with 21.9% of women experiencing psychological distress compared to 14.8% of men. Geographically, Victoria has the highest stress rates, 22%, followed closely by the ACT and Northern Territory, 19%. Western Australia reports the lowest stress levels, 14%. Victoria also leads in annual average lost workdays, 5.7, followed by Tasmania, 5.19. While the ACT has the fewest, 3.35. Earlier research from News Corp's Growth Distillery with Medibank found that 34% of Australians are currently experiencing burnout. Of those, 45% were Gen Z and 41% millennials. These younger generations cite a lack of downtime and feeling overburdened by career demands, family responsibilities, and societal expectations as key contributors to their burnout. Burnout, as defined by the Maslach Burnout Inventory (MBI), is characterized by exhaustion, depersonalization, loss of empathy or cynicism towards work, and reduced professional accomplishment. Millie Bannister, the founder of Gen Z mental health charity ALLKND, argues that framing burnout as simply being too tired from working too much is a gross oversimplification. It's not just a physical state, it's an identity crisis. When work starts stripping away your sense of self, your values, and your ability to connect with others, that's when real damage is done, she says. Bannister emphasizes that burnout is not primarily about workload but about misalignment. When work that once energized you starts to deplete you. So what's the solution? Is it the responsibility of employers to create more supportive and less stressful work environments? Or should young workers develop greater resilience and coping mechanisms? Or is it a combination of both? Perhaps the focus should shift from simply counting sick days to understanding the underlying causes of stress and burnout and implementing proactive measures to address them. How can we foster a workplace culture that prioritizes both productivity and well-being for all generations? What are your thoughts? Do you believe Gen Z is unfairly stigmatized for prioritizing mental health? Or is there a legitimate concern about the impact of absenteeism on businesses? Share your opinions in the comments below.